On FUH Cast, we will be discussing many back-to-school topics that you and your children will benefit from. I'm having today with me Dr. Mazen Abou Chabaan, a consultant pediatrician and consultant pediatric nephrologist at Fakeeh University Hospital. Thank you, Dr. Mazen, for being here and give us your insights about this important topic.
It's my very pleasure to speak about this important topic, especially the timing of the return to school, because the return to school is always associated with too many psychological issues to the students. One of the most important is bedwetting. And thank you very much as well on focusing this very important topics, which is normally not taking a good, valuable corner in the parents' life. And we should encourage the parents actually to look after it, and we will speak about the whole details about the bedwetting so that the parents know how important this topic is and to encourage them to seek advice whenever their child is having this problem.
Yeah, that's true, Dr. Mazen. I usually see a lot of complaints in the clinic about males or females having different complaints about this matter. There is a lot of myth and misconceptions about these things. Some people think that, for example, bedwetting is more frequent in females. Some people think that it's just a psychological problem. They don't even give it a medical cause, which can be an organic cause, and that's why we need to seek medical advice. So I would like to know from you, from your expertise, what do you think it's the prevalence, the age consideration, and the gender population that's most affected with the bedwetting in children?
Actually, bedwetting, we should say and classify it, which is very important for the parents to understand. It's classified into two types. The primary one, where the child is since birth till now, is having the bedwetting and is having it as a main problem in his life and the life of the parents as well. And the child who's having bedwetting, which has started after a couple of years of being born, and he was completely clean and dry after weaning of the parent, after the parents have weaned the child and they removed his diaper. So these are two important issues. And for me, if I interview the parents and know from their history it's a primary, there is a way which I should focus on, and if it is secondary, there is another way. Since we are speaking about, the return to school, it is most of the time it's a secondary, it's not a primary one. And you can notice, I'm sure, Dr. Asara, and you are facing in your clinic, too many kids, they come with different psychological problems after, returning to school. Because returning to school means they are meeting new faces, new friends, a new atmosphere, and in nature. The students do not like schools in nature. They like, after 2 months of sitting at home, and now to tell them come to school, and the school will start where there is homework, blah, 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 and so on. And how lucky they are if the teacher is a nice teacher who can adapt them, or a teacher is a little bit rough for their benefit. I'm sure if she is a little bit tough with them, which will create them a psychological issue. If I'll go back to your points, the prevalence of the bedwetting, it is more in male than female. From the 5 to 7 years, it is about 20 to 25%. Which is a huge number, of course. But when the age goes on, and when advanced age, it will drop 10 to 15, and in the teen aging, it will drop again from 1.5 to 3%. Which means that bedwetting is solved with the time if the parents and the patient who's having it will be aware about it and will take care of it.
Yeah, that's true, Dr. Mazen, and I agree with the psychological point that you already mentioned. It really affects the kids a lot, and even in my clinic, I see a lots of cases where the kids have lost self-esteem because of bullying problems because they're facing many different difficulties in the school, especially from different peers that bully them, that make them feel that they are less than others, and this is affecting kids in their daily life. And parents also have a very important role to face this issue, and for us also as pediatricians, we play a crucial role in helping the family and working as a multidisciplinary team to help the family face this problem and make the kids' life easier and their back to school period healthier. Dr. Mazen, do you think is there like any specific risk factors that are, I know bedwetting has a lot of risk factors, but according to your experience, do you see here in the UAE risk factors that are more frequent for bedwetting that we should take into account?
Yes, I would like to stress on one small point, Dr. Asara, before I go to this one. The parents should be aware that bedwetting is not a joke. Bedwetting is a disease, and they should seek advice whenever they feel that their child is having bedwetting. I mean, bedwetting, till the age of 5 years, we close our eyes, we just encourage the child. Child should not be punished by any means, you know. The child should be encouraged to stop bedwetting, but not punished for bedwetting. And always, I mean, if I know that, or if I believe that bedwetting is a disease, then it is like any other disease. I should not leave my child with it. I mean, I should seek advice. I should work with the doctor together to help this problem. Back to your question, I mean, if you think that in this part of the world where we are living, that there are more causes for bedwetting than other places, maybe because of our society, which is a multinationality society, and the children or the students, they are facing different faces, different nationalities, different cultures.
Maybe the stress factor is more prevalent.
Exactly. Where they cannot, I mean, integrate themselves with the others easily because of the different culture they are living in. And that, of course, might affect their psychological status from inside, which will affect itself on bedwetting and too many other problems. Constipation will affect their way of thinking. I mean, they're being absent-minded and so on. That all will be affected.
Yeah, that's true, Dr. Mazen, and especially that's why we decided to raise awareness about this topic today around back to school period, because I feel this topic is underestimated and we don't give it the real value that it has. Dr. Mazen, I would like to know, for example, I have a lot of patients that come to my clinic. I reach some point that I feel that I need to refer, I'm a general pediatrician, I feel that I need to refer to pediatric nephrologist, especially if I try to follow different steps and I feel there's no improvement. So I would like to hear from you, what are the different steps in the treatment of this specific issue, and when us as general pediatricians, it's better to refer to the nephrologist for the best care for the children.
I would say, Dr. Asara, thank you for this question. I mean, it's a very important question. I would say bedwetting, I mean, should belong to a nephrologist, you know, and the nephrologist as well should be honest enough to know when to refer this patient of bedwetting to other subspecialties, because a bedwetting is a combination of too many factors. It can have an underlying cause if it is of the primary type, and it can have also a psychological factor, which, I mean, during to our timing in the clinics and due to our engagement with other patients, it's very difficult for us as pediatricians to deal with it, and the psychologist should be dealing with it. What I can stress on, and I advise all my colleagues, pediatricians, not to start medication for bedwetting except after referral to the nephrologist, who can decide whether it's needed or not. It's very easy to write medication. It's the easiest thing to write medication. But the one warning that if you stop the medication, the child will be returning back. He will have a relapse, which we don't want, you know, which we don't want. Sometimes, yes, sometimes we do medication, but just to overbridge, just to overlap a certain period, but not as a full treatment. No, we should treat the underlying cause. We should treat the psychological status of the child. We should treat the culture the child is living in, the parents' psychology, how the parents are treating the child, how the personality of the child. If we work with all these factors together, I can assure you that the child will be cured of it.
Yeah, like we should target it as a multidisciplinary team, as you already mentioned. Maybe the pediatrician, the nephrologist, the psychologist, and many other medical staff can be involved in this process. Personally, in my practice, Dr. Mazen, I would like to mention that I never prescribe medications for this type of kids, and I definitely prefer to refer to a knowledgeable and specialized pediatric nephrologist. Maybe like I try to take the questionnaire from the parents, try to know the cause, the risk factors and all that, but at the end it's better to refer to a specialized person. With the school time coming soon, Dr. Mazen, is there any specific advice for parents that would you like to give? So they will, because I'm sure they play also a crucial role at home also and at the school. As you already mentioned, we should not use punishment in this process. Some parents, sometimes they are very stressed, they come very tired from work and they find this bedwetting at home and then they start punishing and then they have anger towards the kids. I would like to also mention how bad is this and how complicated will be the case, because we need to make it simple, we need to raise it in a very nice way, we need to use the positive reinforcement for the child, explain that this can happen, you're not the only child that have this in the school. So what do you think is the main role of the parents at home and around the school time?
Dr. Sarah, as what we discussed before as well, I mean, the bedwetting is it is a big insult to the child. And it is actually psychological. It changes the whole psychology of the child. You will find that the child is isolated. You will find that the child doesn't like to do new friendship with others. He is most of the time sitting. He doesn't like to share in the activities of the school. He doesn't like to do any other, creative or proactive roles in the school, because he's always afraid of. He doesn't share in journeys, he doesn't share in camping, he doesn't share in anything, because he is always putting in mind, if I get the bedwetting when I wake up, what should I tell my friends? I mean, how they will find me. And as you know, of course, that in the schools, they will not have mercy on anybody. I mean, the children in that age, they want just something to make fun of, you know?
Yes.
And that's why the child is in need for support, is a really an urgent need for support, to increase his psychological status, to increase the confidence what he's having in himself, and to let him know that it's a disease like any other disease. It's treatable. Put your hand in my hand. Wallahi, Dr. Sarah, this is what I'm doing. When the child comes to the first session, I ask him, do you like to get rid of it? Are you annoyed? He said, yes, I'm so much annoyed. Yeah. Okay, put your hand in my hand. Promise me that you will do. Yes, Wallahi, I swear by God that sometimes without a treatment, the mother will call me the next week and she says, doctor, what have you done? Yeah. The child is fine. I told her I didn't do anything. That's it, the confidence. Just is to let him know that he can do it.
He can do it, yeah.
He can do it. And by the way, the child should be sharing in everything, in removing the bed cover. After, if he wakes up and he finds that it is wet, he should change himself. He should do everything by himself. If he will do that, he will know that he is involved. Yes. And he should get rid of it by himself as well. And inshallah, it's very easy to do it.
Yeah. So now it's time to take action, Dr. Mazen, and tell the parents or advise them that every time your child is having bedwetting, especially if they are more than 5 years, males or females, it doesn't matter, please seek medical advice. Please don't underestimate this topic. It can really affect your child. And Dr. Mazen, we would like to have a final advice for the parents, or like a message for them.
If your child is suffering from bedwetting, please seek medical advice, especially as you remember we classified it into two types. If it is the primary type, it means the possibility of having an underlying cause is too high. So the underlying cause should be found and should be treated to let your child live his normal life and enjoy his life and enjoy his school start. I wish all our children, I mean, the best in the start of their schooling, and they have the right to live in a comfortable, nice way without having every day a new headache and a new problems facing in the school.
Yeah, thank you so much, Dr. Mazen. It was really amazing to have this time and know more about your expertise and about your clinical practice. Thank you so much. Keep following us on FUHcast. We will be discussing many back-to-school topics that you and your children will benefit from. See you later.